This is the Sex and Psychology Podcast, the sex ed you never got at school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. Maintaining good vaginal health is not something that is usually taught in traditional sex education. As a result, many women don't know what they really need to know about it, which leads some women to turn to products and practices that might do more harm than good, like vaginal steaming, which we've talked about previously on the show and doesn't need to be and shouldn't be part of your regular vaginal health practices. So today's show is going to be all about how to have a happy and healthy vagina. Some of the topics we'll discuss include how your lifestyle impacts your vaginal health, how to maintain the proper pH balance for your vagina to reduce risk of infections, tips for dealing with vaginal dryness, what you need to know about feminine hygiene products, as well as tips for choosing the contraceptive that's right for your body. My guest today is Mary Jane Minkin, a practicing gynecologist, a North American Menopause Society certified clinician, and co-director of the Sexuality, Intimacy, and Menopause for Cancer Survivors program at Similau Cancer Hospital. She has taught at Yale School of Medicine for more than 41 years and is a clinical professor of obstetrics, gynecology, and reproductive sciences. This is going to be another fascinating and very practical conversation. Stick around and we're going to jump in right after the break. Do you ever find yourself dreaming about a career where you get to talk about sex and psychology all day long? What if I told you there's a place that can connect you with world-class experts and has a large, thriving community? Sexual Health Alliance does just that. Sexual Health Alliance helps you to build the career of your dreams and is at the forefront of sexuality education. Students come from all parts of the world and from all types of backgrounds. Whether you're in school just starting out on your journey or building advanced skills in your profession, Sexual Health Alliance's comprehensive certifications, engaging events, and self-paced online education will move you beyond the basics and set you up to become sexceptional. Visit sexualhealthalliance.com and start building the sexuality career of your dreams today. And let them know that you heard about Sexual Health Alliance on this podcast. If you love the science of sex as much as I do, consider becoming a friend of the Kinsey Institute at Indiana University. The Kinsey Institute is the world's premier research organization on sex and relationships, and you can help them continue the legacy of Dr. Alfred Kinsey, whose pioneering research changed everything we think we know about sex. Visit kinseyinstitute.org to make an impact. Your donations can help support ongoing research projects on critical topics. You can also show your support by following Kinsey Institute on Facebook, Twitter, and Instagram. Thank you for supporting sex science. Hi, Mary Jane, and welcome to the Sex and Psychology Podcast.
Thank you very much, Justin, for asking me to be with you.
It's a pleasure to have you here. So in today's show, we're going to be talking all about how to maintain vaginal health. And to start off, I wanted to talk more broadly about how lifestyle factors can influence vaginal health. And I think this is important because in previous episodes, we've talked about the vital role of lifestyle factors in maintaining penile health and how things like diet, exercise, smoking, and alcohol use can affect penile health and function. And I'm assuming that these same sorts of lifestyle factors are probably going to have impacts on vaginal health and function too. So what can you tell us about that? What role does your lifestyle play in having a happy and healthy vagina?
Well, that's an excellent question. And I don't know, I talk about this all the time, and I don't know that anybody's ever asked me that exact question as far as lifestyle and a lot of other things, but I don't know about vaginal health. But certainly there are many things that can be factors in it. And in general, most stuff that isn't good for you in general probably isn't good for your vagina. I think that's one way of looking at it. And some of the stuff may sound indirect, but it's still important. So for example, you might say, what role does cigarette smoking, which is really a very unhealthy habit to have with your vagina? Well, it certainly can for a couple of things. Number one, that unfortunately, women who smoke are at much higher risk of cervical cancer. And that most people don't know that. Okay, they're also at higher risk of bladder cancer. And let's face it, the bladder is right adjacent to the vagina. So it also has an impact there. So cigarette smoking is very bad for you, bad for your vagina, bad for your sex. Basically also makes you more susceptible to like HPV infections. which we know aren't good for the cervix and the vagina. So that may sound indirect, but it's real. Another thing that may sound crazy, but is true, is that eating properly has an effect on the vagina. How can eating properly have this? Well, for example, if you eat a lot, and you get heavy, you're at much higher risk for diabetes. And diabetics, because of all the glucose that is, not to be gross here, but is coming out through the urethra, and you're peeing out all the extra sugar, that influences the vaginal flora. And so diabetics are much more likely to get yeast infections. And for any woman who's listening to this, I'm sure the guys listen too, that yeast infections aren't pleasant. You don't want to sit there scratching and being uncomfortable and stuff like that. So in a sense, if you're eating a high calorie diet and particularly a high sugar diet, you're going to set yourself up more for yeast infections. A simple thing like that. So that's how, your basic lifestyle issues can really have an important impact there.
Yeah. And something to add to that is I would imagine exercise is probably going to play a big role here as well, because, when we talk about sexual arousal, it's really a cardiovascular event. It's all about blood flow. And so we know from studies of men that getting regular aerobic exercise is actually important for maintaining penile function because it helps to improve blood flow to the genitals. And the same is true for women that, in terms of having that proper blood flow, that's really important for having full sexual arousal and vaginal moisture production and all of these other sorts of things. So yeah, lifestyle is really important, not just for your overall health, but in terms of your genital health.
And one other thing for women to be aware of, and I don't mean to tie in the bladder and the vagina together, but they are embryologically derived from the same tissue. As I tell my patients, when we are inside our mommy's tummies, this tissue is basically the same tissue when it gets started. So bladder health is an intrinsic part of this as well. So one thing, and this is one actual thing that I think does help me motivate my patients on maintaining a good weight, is that urinary leakage, bladder leakage, is significantly affected by your weight. And I know it sounds crazy, but just think of it logically. If you're standing up, and we are in general standing up, we don't go around on all fours and stuff like that, fortunately, that your body weight presses on your bladder. Your bladders and your vagina, which are attached to each other at the bottom of the belly. And the more weight you have, the more problems women have with leakage of urine, which can also impact on sexual health because it sort of makes it a little bit grosser for folks to deal with. And we have very interesting literature out there that I quote to patients, and I really do think this has helped motivate a number of them with weight, that when they're leaking, which is really not fun for them, that incontinence is improved 50% by a 5% weight loss reduction. So you don't have to lose a ton of weight to get much better control over your bladder.
That's an important point, and I appreciate you sharing all of that. So a factor that I often hear about that's important in maintaining vaginal health is maintaining an optimal pH balance. And my understanding is that the vagina is normally supposed to have a balance that's in the moderately acidic range in order to protect against bacterial growth. And if that balance gets out of whack, it can increase the risk of infections. And that's why, for example, many lubricants are optimized for just the right pH balance so that they can play a supporting role in maintaining vaginal pH instead of disrupting it. So let me first ask, how would you know if your pH balance is out of whack in the first place? Like, what are some common signs or symptoms of that?
Well, women who get infections, are basically getting an infection possibly related to this pH balance being off. And one of the problems with things like not only yeast infections, but vaginal bacterial infections, so-called bacterial vaginosis, is really an imbalance of the good guys and the bad guys in the vagina. Is really what it boils down to. And so if you are getting recurrent infections, one of the things that you want to do is to try to maintain a good flora in the vagina, which will make acid and keep the bad guys away. Women in general have a tough time. I don't deal with guys, so I don't know. But women in general have a tough time thinking that acid is good. And I say, no. And this line I always use, and I point to my body all the time. And I say, if you're pointing to your belly, that basically pH, acid in the stomach's not so good. Acid in the vagina, very good. Okay. So, simple concept to do. Now, one of the things that we deal with regularly, and of course I deal a lot with menopausal women, is when the vagina gets dry. when estrogen levels go down. Estrogen sort of feeds the vagina and maintains this sort of nice thick lining of superficial cells. And when that goes away, and these cells contain a lot of glycogen, and we say, who cares about glycogen? Your lactobacilli do. Lactobacilli are the good guys of the vagina, and they love to sit there and chomp on glycogen. That's their substrate. They love that. And they make lactic acid, so they keep the pH in the vagina acid. And this is good. We want a lot of lactic acid in there. We want a lot of lactobacilli. We want nice, like plump estrogenized tissue. And when that goes away, okay, for example, with menopause, that we end up with a situation that's favorable for bad guys to grow. And the tissue itself becomes thinner and is more attackable in a sense. So maintaining a good pH is very, very helpful, and maintaining moisture in the vagina is very good. Now, there's one other time that women don't think about where they are very prey to dryness. And again, I don't want to discourage any of our listeners from breastfeeding. Breastfeeding is a wonderful thing for babies. But the problem is when women breastfeed, their estrogen levels go down. And when they're dealing just with a vagina like a postmenopausal woman will deal with. So they are much more prey to a vaginal infection. So maintaining good moisture is good. Maintaining a good pH is a good thing, again, to try to take away from these recurrent infections, which can really plague people. And for example, a couple of products that are out there that work very nicely, and I use these all the time with my patients, for moisture, a product like an over-the-counter moisturizer, something like Replens, which you can get at CVS or Walmart or whatever, is a gel that you scoot in the vagina that keeps the tissue moisturized. However, if you're specifically looking for a pH balancer to say, yes, I want to get that tissue more acidic, something like Refresh, which is sort of like the Replens gel but has a pH balancer to help lower the pH, is a good thing. Again, acid in the vagina, good. Acid in the stomach, not good. Simple mantra to remember.
Yeah, thanks for sharing that. And that all makes a lot of sense. And I was going to ask you as a follow-up whether there are any other things that women should know in terms of things they can do to maintain that optimal pH balance, or things that they shouldn't do in order to risk having that disruption. So the first thing that comes to mind for me would be something like vaginal douching, in terms of how that might potentially impact the pH balance. So do you have any other advice or guidance in terms of what to do or not to do in terms of maintaining that pH balance?
Sure. Douching is something that we actually tend to discourage, because we don't want to wipe out the good guys that are there. We want to maintain the good guys there. Bacteria, and again, my patients sometimes get nervous. Oh my God, my doctor's talking about that. I have bacteria in my vagina. And I just look at them and I say, listen, your doctor's got billions of bacteria in her vagina, so don't worry. This is good. And I tell when I teach my medical students, I said, now boys, you can't use this line, but the girls in the class can use it. It's just fine. So douching is something in general we tend to not recommend. I mean, some people like to do it. And I say, all right, if you like to do it after your period, but just do it once, don't keep doing this every day. Not a good thing to do. If you do feel that there's some sort of, an imbalance going on, again, we talked about something like, a product like Refresh is good. The other question that comes up sort of is correlate to this sort of thing is, what about certain probiotics? Do probiotics help? And there is some data to suggest that they may be helpful. And again, the probiotics are, looking to get good lactobacilli in there and to try to maintain the good activity of secreting lactic acid, stuff like that. And there are some products out there. I mean, a product like Pro-B, for example, it's a probiotic basically that you can take by mouth that ends up ending towards the vagina to help re-acidify the vagina. And again, things that you're trying to maintain that health.
Yeah, that all makes sense. Now, speaking of products for vaginal health, in recent years, we've seen a ton of things emerge on the market that purport to help women maintain vaginal health and hygiene. You've got the supplements, the cleansers, the creams, balms, wipes, even the steam therapy kits, right? And many of them are aimed at dealing with issues related to vaginal odor or cleanliness. So I wanted to ask you, as a gynecologist, for your take on the growth of the vaginal hygiene market, and whether women actually need any of these products, and whether some of them might be causing more problems than they actually solve.
In general, we think most GYNs think that they're more problematic than helpful, is what we would say. Certainly, the one thing that I would say anybody should be against is steaming the vagina. Okay.
Yeah.
I mean, when I heard about this the first time, I said, it's the craziest damn thing I heard. And there actually are case reports in the literature of women getting second-degree burns of their vulvas from steaming in the medical literature. So it's like, why would somebody do that? Why would you want to get a second or third degree burn. It's crazy. So anyway, so don't steam your vagina. As far as most of these other things, again, people oftentimes use the line self-cleaning oven sort of thing. In a sense, it is a self-cleaning oven. You really don't have to do too much down there. And again, you don't want to disrupt that pH. You don't want to wipe out the good guys. And again, the other thing to remember is the vulvar and vaginal tissue is about the most sensitive tissue in the body, composed to our skin on our arms or whatever, things like that. And people can get allergy reactions, allergic type reactions anywhere, including their vulvas, including their vaginas. And it's a hell of a place to want to itch and scratch. I really don't want to do that. So the less stuff you put in there, the better.
Yeah, I think the saying less is more is very applicable.
Less is more, definitely, in this situation. You really don't want to go, fooling around down there with, too many extra products that you don't really need.
Yeah, and there is the potential with a lot of these products to lead to skin irritation and other things. And you often don't know how these products are going to interact with your own body. And if you're going to use any of them, I think it's a good idea to try and test them on another part of the body first before you put them on your genital area, because, you'd rather have like a little small spot on your arm that's irritated as opposed to, a big genital flare up. That's a whole other issue.
Absolutely. But even if you get pass a good skin test in another part of the body, you may end up with a worse sensitivity in the, perineal vaginal area, because that tissue is that much more sensitive.
Yeah, that's true. And that's an excellent point. So another common issue that often impacts the vagina is dryness. And you mentioned this a little bit earlier about how it can come up, particularly in the case of menopausal women. And we know that, there is this association there because there are hormonal changes that are happening in the body as women enter menopause. But dryness is something that can affect younger women as well.
Sure.
So in a nationally representative survey of 2,000 US adults that we did at the Kinsey Institute, people were aged 18 to 45, we found that 12%, or about 1 in 8 women under the age of 45, reported issues with vaginal dryness in the last year. So let's talk about dryness issues for younger women first, for those who aren't menopausal. What are some reasons why younger women might experience vaginal dryness, and what are some potential solutions for it?
Sure. Well, there are certain things that are well known. And again, we get back to the breastfeeding issue, of course, is right up there too. So if our breastfeeders out there, don't stop breastfeeding. We can get you moisturizers. It's okay. Breastfeeding is good for the kid. A couple of things that some women wouldn't think about, that antihistamines are very, very commonly used. And some people use them not only for allergy reactions or things like that. They'll use them, for sleeping aids. Many people use an antihistamine to help them go to sleep. And that's particularly vulnerable. The women who are particularly vulnerable to that are the menopausal ladies and the perimenopausal ladies who are having trouble sleeping. They're dealing with dryness to begin with, and they start taking antihistamines. That's very bad. That's not a good thing at all. So anyway, antihistamines can dry anybody. So I would avoid antihistamines if you are dealing with dryness issues, and say, maybe I should try something different and see what that does. So that's something to keep in mind. The other thing that can be an issue is some birth control pills. And there are some people who are adamant against birth control pills. And some of my friends in some of the sexual organizations, they're very opposed to birth control pills. So I think birth control pills are fabulous for some people. But for some women who are trying, and what the issue is, they try to go for the lowest dose of estrogen possible. Okay, I understand that. But the problem is estrogen is your moisturizing hormone. So if you have a pill that's got a fair amount of progestins in it, synthetic progesterones can be drying, and they're not getting a lot of estrogens, they may end up dry. So one of the things that I will actually, if somebody comes to see me who I haven't been dealing with and stuff like that, the first thing, they're complaining as a young woman, I'll say, let's look at your birth control pill and let's maybe alter things. Now, sometimes their previous doctor told them they have to go off the birth control pill. It's like, no, you don't have to go on the birth control. We can get you a higher dose of estrogen pill, which will give you more moisture. And that, I think, is, and again, because many of these women like the birth control pill for convenience and menstrual control and all sorts of things like that. But we can manipulate the pill to get them a higher dose of estrogen that will take care of their dryness situation. And so that's something that's fairly easy to do. And so if you're on the pill and you say, oh, I don't want to have the doctor or the midwife tell me to stop the pill, no, we can try a different pill.
Yeah, I appreciate you sharing that, because it sounds like there are lots of things that could potentially be impacting vaginal moisture, vaginal dryness that we might not intuitively think of. When we've talked about this before on the show, the most common thing that comes up is that, well, maybe you're not spending enough time building up arousal first, and that's not creating enough opportunities for vaginal moisture. And we know that that can be part of what's going on here. But as you mentioned, there might be some other underlying factors that could be contributing to that you might want to look at as well.
Although going back to the arousal question, that's an interesting question and statement that you raise, because a few years ago, I'm trying to remember, it was before the plague, maybe 2018, 2019, I was asked to give some talks at a bloggers convention in Los Angeles. And what was interesting is a number of these bloggers were asking me about pelvic pain in young women, really young women. And this was a question that I deal a lot with menopausal ladies, but I also take care of some young women. I was really astounded by the number of questions I got on that, and also relating to dryness issues. And I started asking the journalists, why did they think that they were seeing, we were all seeing this, now? The comment was that many people are looking at porn these days in volumes that people didn't look at porn before. I mean, they couldn't afford all the GQ magazines or whatever they were reading and stuff like that. But, you can turn on anything you want on the net. And that young women and young men were looking at porn, and they see all this sexual activity without any stimulatory activity. And that was their model for sexual activity, was just let's go at it, without any foreplay. And indeed, that made sense to me logically to say this is what these people were accepting as normal sex. So I think there is some play in that as far as the dryness issue, that some of these people are not dealing with proper arousal.
Yeah, and that absolutely is true about pornography. And we've talked about and made similar points on the show before about how porn should be thought of as entertainment and not education, because when you're looking at what's happening on screen, that's not necessarily a good model for how to actually have sex in your own life.
And have enjoyable sex.
Yes, because there's a lot that happens behind the scenes that you don't see. I often liken watching pornography to watching a cooking show on TV, where you're just seeing like these little highlight reels, and you're not seeing like all the footage that is on the cutting room floor that just never made it into the final scene, the preparatory portions where people might stop and apply lube and stop and reapply again and all that other stuff. You don't know all of the other stuff that happened that went into making that particular scene.
Absolutely.
So we've talked about vaginal dryness for younger women. Let's talk about for menopausal women, right? So we know that dryness is an issue that often comes up during menopause as a result of hormonal changes in the body. So what are some ways of dealing with it for menopausal women?
Well, there are many ways that women can deal with it. When I sort of break it down in a discussion with my patients, I'll say, okay, we have non-hormonal remedies, we have hormonal remedies, okay? And then we break down hormonal into systemic and topical. I know it gets complicated, but it's not bad. It's not bad. We'll get through it. And so if somebody says, well, I'm not interested in hormonal intervention, we have many fine over-the-counter, and basically by definition, something that has hormones in it has got to be prescription. But the non-hormonal products are available over the counter. And again, the most important thing actually that I want to start with is talking about square one, is talking to people about the difference between a moisturizer and a lubricant. Many women do not know that there is a difference. And I'm sure you've talked about that with, your listeners and participants, that people are totally confused about what's what. And in general, moisturizers are products that are used on a regular basis, 2, 3, 4 times a week, whatever, for the woman. And they're not necessarily related to sex at all. And they're for maintaining moisture and maintaining comfort as well, because dryness can be uncomfortable, and period, end of sentence. That's all there is to it. Lubricants are in general products that are applied at the time of intercourse, okay, or using, dilators and vibrators and things like that for comfort. And in general, they're not going to give people long-lasting relief. Now, many of my patients tell me they use various and sundry lubricants and it lasts them. And I say, God bless you, that's fine. That's terrific. I'm glad it's working. But for many people, they really need the lubricants as well as a moisturizer. And one does not preclude the use of the other one. There are many people who use both. And again, my first statement, when particularly with lubricants, but also with moisturizers too, I tell people, please don't buy the giant economy size before you try it first. because, many of these lubricants have a perfume in them or some other ingredient, which, may sound attractive, but it may be terribly irritating, as we were talking before, on the skin and on the vulva and the vagina. And buy a bunch of different ones and see which ones you like. That's probably the easiest thing that I tell people. So basically discriminating between lubricants and moisturizers is important. And then, talking people through different moisturizers that are out there. I mean, for example, we talked before about Replens, which is a very, very popular product for long-term moisturization, 2-3 times a week with a gel. Works very nicely. There are also suppositories. I mean, there's all sorts of different products out there, which are fine. As I said, as long as you're, happy with it, it doesn't irritate you, that's great. Okay. Now, one thing you have to be careful with is that certain moisturizers can degrade condoms. So that you have to be careful as far as making sure your lubricant is condom compatible, with what you're using. And it says on the side, and you can look at that. So that's something that you want to be aware of. And again, using a moisturizer on an ongoing basis is a very good thing if you're feeling dryness. If those don't work, or you say they're too messy for you, whatever, okay, then we get into the realm of hormonal type products, which are absolutely quite safe. Estrogen got a very bad rep on July 9th, 2002. Not that I remember the day, but anyway. And it was 9:00 in the morning, and I was standing in my Guilford office, but anyway. Which was the day that rocked the world of menopause. And out came the report from the Women's Health Initiative study. It was a study that looked at estrogen usage. And one of the takeaways from this study was, estrogen is going to give you breast cancer. Well, first of all, their data really didn't show that estrogen gave you breast cancer, but that's a whole nother story. But the increased risk that they did show putatively was minuscule. But again, a whole nother story. They were not talking at all about vaginal estrogens. Okay. Vaginal estrogens are safe. Even though the FDA puts on their package insert a statement that says, you're going to get breast cancer from using vaginal estrogens, they just basically make the vaginal estrogen companies put the same warning that's on the systemic estrogens on vaginal estrogens, which is ludicrous. And we're in a move right now to try to get those package inserts changed because we don't want to scare the hell out of people that don't need to have the hell scared out of them. So vaginal estrogens come in many forms. They come in vaginal creams, rings, tablets, stuff like that, which give you a nice level of vaginal estrogen and really don't give you any significant systemic absorption. The other thing that vaginal estrogens are good for, besides moistening the vagina, is that they're also good for the bladder. And again, the bladders are composed of the same tissue that lines the vagina, and that is basically sensitive to estrogen. You got more estrogen in there, your bladder's going to be happier in general. If you got leakage or other problems, that'll help. So those are the kinds of things that will help. The other thing that will help also is systemic estrogen. When you take estrogen by mouth or in a patch or something like that, that estrogen does get to the vagina. Not a huge amount, but it gets there. And so women who take systemic estrogens really oftentimes don't need to do any vaginal moisturization or lubrication. However, about 20% of women will find, particularly because we use fairly low doses these days, that the low doses we use of systemic estrogen doesn't give them quite the moisture that they would like to have. So that's why that many women will benefit by both. And then I get into the arguments with the pharmacists most pharmacists are wonderful people, but some of them drive you crazy. And they'll tell the patient, you can't use this vaginal estrogen. You're already on, patches or pills. And it's like, no, my doctor says that 20% of people who use systemic estrogen still need a vaginal booster. Now, they can use non-hormonal stuff too. I mean, they can always use a product like Replens or something like that in addition, but they will need it, and they're not weird.
Yeah, and thanks for sharing all of that detailed information. And I appreciate that distinction that you made between vaginal moisturizers and lubricants, because you're right. Most people don't realize that there's a difference there. And I think also most people don't realize that not all lubes are the same either. And it's important to recognize, and this is something most people definitely do not know, is that most lubes in the US are not regulated as medical devices. They're regulated as cosmetics. And so there's like a different regulatory approval process. And so that's where oftentimes with lubes, you don't quite know what you're getting. And if you want to, you can look for lubes that are specifically FDA approved, that have gone through more rigorous testing, and that are likely to have a greater safety profile in terms of less interactions with the body. But yeah, it's just something to think about when you're shopping for lubes, is that, look for that FDA stamp of approval if you're looking for something that's going to be more body safe.
Sure. And of course, it's always quite reasonable to check in with your practitioner, whether you see, your midwife, your doc, whoever you're talking to, run it by them to say, okay, does this sound like something that's okay for me?
Always a good idea to check with the doctor. Now, you mentioned earlier something about how contraceptives can impact vaginal dryness. And I wanted to ask you whether there are any other implications of contraceptives for vaginal health. So, for example, can they also impact pH balance or other things like that? So, is there anything else that we know about this topic?
Well, only insofar as that if the woman is experiencing significant dryness, that may help contribute to imbalancing her vaginal pH. That certainly can be a product there. And that's why she's going to do better getting a different pill, probably with a little bit more estrogen, which will probably help her.
So, since we're on the subject of contraceptives, let me ask for a gynecologist's advice on how to choose the contraceptive that's right for you, right? There are so many different options that are out there. They all have some trade offs, and it can be kind of a difficult decision. So, what do you want women to know in terms of choosing the contraception that's right for them?
It's a very important discussion. And the most important thing is we want to get you something that's going to work. That's the important thing.
Yep.
And one of the things, and I'll get on one of my high horses as far as talking about medical care these days. In the old days, and again, I'm in a really, really lucky position that I've been in my same practice for 45 years. So I have some patients I've had the privilege of taking care of for 45 years, and I know them pretty well. So I know people and I know their habits, and some of my patients are so meticulous, they remember everything they've ever done in their entire lives. And again, some of my patients will say, I can't remember my own head if it weren't attached. It's people's personalities and stuff. So somebody who says, I can't remember to take a pill every day. Well, I don't want to give her a birth control pill. I just don't. Probably get a little grace period. If you skip one pill, nothing bad's going to happen. You start skipping 2 or 3, bad stuff can happen. So somebody who can't remember stuff, don't give her a pill. Okay. Or if she wants the pill for other benefits, make it sure she has a reminder system in place or something like that. For those folks, an IUD could be a fabulous option. And again, the other thing to remember, although it's really faded in general for most of our young folks' mind, is IUDs had a very bad rep back in the 1970s. Mm-hmm. And they really don't these days. And it's good that they don't because they don't deserve it. And the nice thing about the IUDs we have today is, for example, we have one IUD, the copper IUD, that's good for 12 years now. Well, that's pretty good. You throw it in, you got 12 years of contraception. That's really good. If you say, I hate my periods, okay, well, but I don't want to take a birth control pill or something like that. We have the progestin-coated IUD, something like a Mirena IUD, which is now good for 8 years rather. It used to be good for 5 years. Now it's good for 8 years. So it gives you pretty long-term contraception and will make your periods much nicer than they were. So you get a little added benefit. So it's like thinking of, is this contraceptive going to work for me for birth control? But what other added benefits do I get? If you get miserable cramps or heavy flow, well, you may want to consider a birth control pill. You may want to consider a progestin, IUD, something like, again, the Mirena. So you have all these different options out there. The one thing, though, that you have to remember, and this gets back to the vagina, of course, is that these are wonderful methods of contraception. However, unfortunately, they don't have that STD, STI protection. So even if somebody's using a birth control pill, which is very lovely for contraception, I still always say, and I would be remiss if I didn't remind you to keep using those condoms. Condoms are very, very important. So pick up your pack of Trojans when you pick up your pack of pills. That's just something, unless you're 100% sure you're in a mutually monogamous situation forever and ever, and amen. And that's great. STD protection is very important. Contraception is very important. And we want to get the right contraceptive for you for your lifestyle. And what extra benefits will you get out of it as far as cycle control, heavy flow, crampiness, things like that?
Yep. And I think that's where talking to your doctor and figuring out, what is going to be best for you in terms of your own unique body and also in terms of your lifestyle, like all of them have different implications. And so consulting with a medical provider is definitely the best way to go.
Always helpful.
Now, I know we're running short on time, but I have another question for you, which is whether there are any other tips you want to share on maintaining a happy and healthy vagina. And if not, what's your top line takeaway on what you want people to know in terms of vaginal health?
I was asked a number of years ago, I'm queried by various women's health magazines and stuff like that. And they wanted me to comment on an article for the absolute safest and everything free hookup that one could do. And I said, you want me to do what? I said, it's called a vibrator. I mean, the only thing that I can tell you that's really absolutely safe for a hookup is, you got to be concerned about pregnancy. You got to be concerned about STIs. You got to be concerned about all that stuff. So that's why I discourage people from having casual sex without protection and stuff, because it's just not a great thing to do. So be kind to your vagina that way. And again, the other major thing that I would discourage people from doing is getting crazy products, that could be allergic as hell to their bottoms, and it could irritate them. And I just don't want people getting irritated and uncomfortable. It's wonderful to have, to have a great vagina and to have great sex and things like that. But having an uncomfortable vagina is not really a very good thing for most folks.
Yeah. Nobody wants an uncomfortable vagina.
Definitely not.
So thank you so much for this amazing conversation, Mary Jane. It was a pleasure to have you here. Can you please tell my listeners where they can go to learn more about you and your work?
Oh, my exciting work? Well, my exciting website is called madameovary.org. The title was chosen by my husband, who many years ago, when domain names became available, his rationale for that is, what do you call a gynecologist who was a French minor in college? So that's where it came from.
Well, I love the name Madame Ovary, because when I first saw that, it reminded me of one of my favorite books in high school. In my AP English class, we read Madame Bovary. And I love that book. So when I saw Madame Ovary, I was like, I'm going to like Mary Jane. We're going to get along just fine.
Well, my husband's the one with the funny name. You get to listen to him too. He's maybe a little crazier than I am.
Well, that's what spouses do. Well, thanks again so much for your time, Mary Jane. I really appreciate having you here.
Thanks much. And thanks for what you're doing for your listeners, because it's very educational for them. And we want everybody to be healthy and happy.
That we do.
Thanks much.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. You can also follow me on the socials for daily sex research updates. I'm on Twitter and TikTok at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. And if you have a question you'd like me to answer on a future episode of this show, you can leave me a podcast voicemail at speakpipe.com/sex and psychology. Thanks again for listening. Until next time.